behavioral therapies improve insomnia by 70 to 80% for adults and often have better long-term outcomes than sleep medications.
One of the messages that is very strong in your book is that these behavioral sleep treatments, for example, cognitive behavioral therapy for insomnia, sleep restriction, they can work better than long-term medication because they are actually retraining the brain, almost like exercise retrains your body. So why is retraining the brain so essential for real sleep recovery? Why are you such an advocate for those methods?
So if sleep is a basic biological process, it's something we're all physiologically hardwired to do, then when that system gets disrupted, it makes sense that if we can change some things, we can figure out what got people stuck and get them unstuck, they can return to baseline. They can come back to doing what their body knows how to do. And I'm a fan of that over medication because lots of times the medications come with some additional challenges or side effects. For some people, they don't have access to medication, right? It is costly. And depending on their individual physiology, there may or may not be medications that are effective for them. And the science supports that this behavioral intervention is the most effective. When we look at the guidelines, we have clinical practice guidelines that come out from lots of different accrediting bodies that look at all of the research and say when we compare, cognitive behavioral therapy for insomnia to medications for insomnia, the preponderance of evidence is in support of CBT-I. It is the frontline recommendation by the American Academy of Family Physicians above medication. There can be cases where medication is appropriate, and I work with a lot of providers in collaboration, but I also see a lot of people who've tried medication first and are still having some sleep problems. And in fact, some of the medications change the sleep architecture, the way we move through those sleep stages at night. A lot of sleep medications are meant to be used on a short-term basis, but I'll often see people who have been on them for decades. And so sometimes we do cognitive behavioral therapy for insomnia plus a medication taper to help people stop medications.